There's a moment I've witnessed countless times. A patient sits in front of me, calm, almost relaxed, and says something like, "Doctor, I don't feel sick. Just a little slower than before." No sharp pain, no emergency, nothing dramatic. And yet, when I look at their lab results, I see something else entirely. Kidney function, quietly declining, sometimes for years. And what makes this particularly difficult is that the person truly had no clear warning. Now, let me be honest with you, this is not rare. In fact, it's becoming increasingly common after the age of 50. Before we go any further, I want to make something very clear. What I'm sharing here is based on my experience as a physician. It is not personal medical advice. Your health situation is unique, and any concerns should always be discussed with your own doctor or healthcare professional. If you appreciate this kind of slow, thoughtful explanation, you may consider subscribing. I don't rush through these topics. I explain them the way I would to someone sitting across from me in my office. Now, here's where things often go wrong. Many people believe that if the kidneys were in trouble, they would feel it. Pain, discomfort, something obvious. But the kidneys don't work that way. They are quiet, extremely quiet. And this is where most people make a critical mistake. They assume that feeling mostly fine means everything is functioning normally. Let me explain what actually happens. As we age, the body systems don't suddenly fail. They adapt. They compensate. Your kidneys can lose a significant portion of their function before any clear symptoms appear. And during that time, small everyday habits continue to shape their condition. Let's go through the most common ones I've seen over decades of practice. First, chronic low-level dehydration. Not severe dehydration, nothing dramatic. Just consistently drinking a bit less than your body needs. This happens often after 50. The sense of thirst becomes less reliable. People drink less without realizing it. And over time, the kidneys are forced to concentrate waste more intensely. That creates strain. Day after day, year after year. And here's the subtle part. It doesn't feel dangerous, it just feels normal. Second, frequent use of pain relievers. Now, this one deserves careful attention. Many people rely on medications like anti-inflammatory drugs for joint pain, back discomfort, or headaches. Taken occasionally, they are generally safe for most people. But regular use, especially over years, can reduce blood flow within the kidneys. And this is where people get caught off guard, because these medications are so common. They don't feel risky, but the kidneys remember, even when you don't. Third, blood pressure that is a little high. Not dangerously high, just slightly above normal. This is one of the most underestimated risks. Elevated pressure damages the small blood vessels inside the kidneys, slowly, quietly. And because it causes no immediate discomfort, many people delay taking it seriously. Years later, the effects become visible. Fourth, blood sugar that is almost normal. I've had many patients say, "Doctor, I'm not diabetic." And technically, they were right. But their blood sugar was consistently higher than ideal. Not enough to trigger alarm, but enough to cause long-term damage. The kidneys are sensitive to this, very sensitive. And over time, even moderate elevations can affect their filtering ability. Fifth, excess salt hidden in everyday foods. This isn't just about adding salt at the table. It's about processed foods, packaged meals, sauces, things that don't taste overly salty but contain more sodium than expected. This contributes to fluid retention, increased blood pressure, and additional strain on the kidneys. And here's the key point. Most people underestimate how much they consume. Sixth, reduced physical activity. Now, I'm not suggesting intense exercise. That's not necessary. But a gradual decline in movement, walking less, sitting more, affects circulation, metabolism, and blood pressure, all of which are closely connected to kidney health. And this is where small changes accumulate. Seventh, ignoring subtle warning signs. Let me mention a few that are often overlooked. Slight swelling in the ankles, urine that appears more foamy than usual, fatigue that feels different, harder to shake. None of these are dramatic, but they are signals. And signals are meant to be noticed. Eighth, multiple medications without regular review. This is more common than people realize. A person sees different specialists. Each prescribes something. And over time, the combination becomes complex. Individually, each medication may be appropriate, but together, they can place additional stress on the kidneys. And unless someone takes the time to review the full picture, this often goes unnoticed. Now, let me pause here for a moment, because there are also deeper influences that don't get discussed often enough. Chronic stress, for instance. It raises blood pressure and increases inflammation. Poor sleep, which affects hormonal balance and recovery processes in the body. And even long-term low-grade inflammation, something we're only beginning to understand more clearly. These factors don't act alone. They interact. They reinforce each other. And this is where the real problem lies. What damages the kidneys after 50 is rarely one single issue. It's the combination. Small things repeated daily, gradually shifting the balance. The body adapts for a long time, but eventually it reaches a point where compensation is no longer enough. And that's when people begin to notice something is wrong. But by then, the process has often been developing for years. So, what can you actually do about it? Let me give you a simple, realistic framework. First, drink water regularly, not just when you feel thirsty. Make it part of your routine. Second, be cautious with pain medications. If you use them frequently, discuss it with your doctor. Third, monitor your blood pressure consistently. Don't rely on how you feel. Fourth, keep an eye on your blood sugar even if you're not diabetic. Fifth, reduce hidden salt. Focus on fresh, simple foods when possible. Sixth, stay physically active in a way that feels sustainable. Walking is often enough. Seventh, pay attention to subtle changes in your body. They matter. Eighth, review your medications periodically with a healthcare professional. And finally, include kidney function tests in your routine checkups. They are simple but extremely informative. Let me leave you with something I often tell my patients. The kidneys don't demand attention. They don't force you to stop and notice them, but they respond quietly to how you live. And the decisions you make today, even small ones, can influence how well they serve you in the years ahead. Not dramatically, not instantly, but steadily. If you found this helpful, you may consider staying with this channel. There's no urgency here, just careful explanations built on years of observation and a desire to help you understand your body a little better.